The heart of really what we come to do well is understand our clients.
Understanding what the needs of the family are.
Help them make some decisions.
Preparing the next generation for what's to come.
Being on a first-name basis, getting to know their stories.
Working through their questions, their concerns, and figuring out the solution that's best.
They trust us enough to come in and help them solve that.
You really feel at the end of the day when you add value, there's a great sense of accomplishment and reward.
Henry David Thoreau once said, "It's not what you look at that matters, it's what you see." In managing wealth, there's an awful lot to look at. Taxes and trusts, family meetings and bonds, and everything in between. It's why we rely on those who know each of these fields so deeply that they can see where others are merely looking, who can focus on what's best for clients over generations. After all, that's what expertise is.
Hi, my name's Paul Massara from Arrowfield Stud, and we've been using the Equiloom masks generally on our dry mares, but also on some of our maidens as well. We find the Equiloom to be a very useful operational tool. It allows us to have the mares out in the paddocks and roaming freely, not having to bring them into barns. There are also some financial benefits. Obviously there's no stable bedding, the excess staff used, and obviously transporting the horses in and out on a daily basis. That can be time consuming, and this is money I think well spent to save in those operational procedures.
Bloodhorse Plus, available through bloodhorse.com, provides exclusive, timely, and unmatched content to subscribers, including Fox Sports, Bloodhorse branded weekly programs, a detailed stakes winners section, behind-the-scenes videos from Bloodhorse staff, on-demand access to deeper horse statistics, and a $5 monthly credit to equineline.com. Upgrade to Bloodhorse Plus today.
Hi, my name is Gary Falter with the Jockey Club, and I'd like to welcome everyone to today's online panel. So this is our 9th panel in our series of online Zoom panels for this year. And today we're going to cover the topics of equine dentistry and hoof care and shoeing. So we got the horse covered from the mouth all the way down to the foot. So before we get started, just like to recognize our sponsors, starting with our presenting sponsors, which is Bessemer Trust, Stoll Keenan Ogden, and the Green Group. And I'd also like to thank today's panel sponsor, Equiloom, and our Q&A sponsor, West Point Thoroughbreds. And we just continue to thank all of our sponsors for their support of thoroughbred ownership and for working with us to help bring these webinars at no cost to you. So thank you very much, sponsors. So today's panel includes recorded sessions of shoeing and dentistry procedures that are performed on horses by some representatives of Rood and Riddle Equine Hospital. And as we view the videos, we've got Dr. Morrison and Dr. Tanner, who are also veterinarians from Rood and Riddle. They're going to explain what we're seeing on the videos. So we're going to start off the first part with Dr. Morrison, and after he's done, Dr. Tanner is going to join us for the second half of the webinar. So first, I'd like to start off with introducing Dr. Scott Morrison, our first speaker. Welcome, Dr. Morrison.
Thank you. Thank you for having me.
Okay, so just some background on Dr. Morrison. He's a 1999 graduate of Virginia, Maryland Regional College of Veterinary Medicine. He's also a graduate of the Eastern School of Farrier, and he built a successful farrier business before enrollment at Virginia Tech. And following graduation in 1999, Dr. Morrison completed a one-year hospital internship at Rood and Riddle. And following the internship, he was hired by Rood and Riddle Equine Hospital as an associate vet. And he began to develop the Equine Hospital's podiatry department at Rood and Riddle. So today, Dr. Morrison, he's a partner in Rood and Riddle, oversees the podiatry center. And you were with us a few years ago at Churchill Downs, weren't you, Dr. Morrison, when we covered equine podiatry on our in-person conference? So welcome back.
Yeah, thank you. That's right.
Okay, great. So we got a lot of ground to cover. If you have any questions, please use the Q&A button at the bottom of your Zoom screen. And after the videos and the discussion with Dr. Morrison, We'll answer as many questions as time allows, and then we're going to jump into Dr. Tanner, okay? So let's get started with some images and a video of a racehorse that's getting reshod. And as we progress through the images and the video, we'll pause and I'll ask a few questions of Dr. Morrison. So we're going to show the first image on the screen. Okay, so Dr. Morrison, this looks like the horse, an image of the foot before it's trimmed, looks like a pretty long toe in that foot. So kind of give us your assessment of this foot before the shoeing actually takes place.
Yeah, it just looks like the toe is growing forward. You know, the heels are underrun. Looks like there's excessive length of hoof wall on that foot. So it looks like a typical foot that's kind of overdue to be trimmed and reset, reshod.
So how long do you think it's been since this horse has been reshod, just based on what you're seeing there?
I'd guess it's been 5 weeks or so.
Okay.
Looks like 5 weeks.
Okay.
4 or 5 weeks.
Okay, so now I think, Dr. Morrison, you've got some other slides you'd like for us to put on the screen. So
yeah,
which one do you want to start with?
Yeah, we can put the picture image 1 up. Yeah, just why do we trim horses' feet and reset them? Typically, we do it at 4-week intervals, especially on race horses or athletes. It's important that we keep their toes short. As you can see on these 2 images, the one on the left is more of an ideal kind of foot, and the one on the right is a horse with a long sloping pastern and a low hoof angle.
Mm-hmm.
And as the his foot grows, they typically grow toe faster than heel, so their toe length will increase faster than their heel length, and that effect on the limb is that it decreases the hoof angle throughout a shoeing cycle. So it's been shown, horses' hoof angle generally will decrease by, on average, 3 degrees. So if a horse has a 54 hoof angle, in 4 weeks, that'll decrease to 51 or 50 or so. And, hoof angle has a very important biomechanical effect on all the structures of the lower limb, particularly the tendons and suspensory. So you can see on these images, if the toe is nice and short, you have that blue arrow denotes the lever arm or the moment arm about the fetlock joint. So, as the toe is short, you have a shortened lever arm there, which puts less stress on all the structures on the back of the limb, all the flexor tendons and the suspensory. As that toe grows longer, like on the image on the right, you can see that lever arm, that distance increases, and that puts more strain on all those structures. So it's important for athletes to keep them sound, that we keep their foot balanced and we keep things in proper alignment.
So let me ask you, if the horse on the right was scheduled to race in a couple of days, would you have that foot trimmed and reshod before that horse ran, or could it actually run with
Absolutely.
that long toe?
Yeah, I'd recommend that horse get reset, because when they run, you're asking them to go, close to their maximum capacity, right? You want to win, you're going to go all out. So you don't want to strain those structures on the back of the leg. There's a built-in margin of safety on horses, and their margin of safety is not really that great. It's not like man-made objects like elevators and stuff like that have a multiple, the margin of safety is many times their natural loads. So when you're asking these horses to go at maximum loads, you don't want to flirt with that margin of safety. You want to keep things in balance.
Okay. Is there another slide you want?
Yeah, we'll go to the next slide. So, this is just a radiograph of a horse's foot. We talk about balance. What is balance of a horse's foot? That's discussions between farriers and veterinarians for centuries. What's ideal balance? But there are certain things we can agree on. If I could use does my pointer show up here? Yeah.
No.
Okay, sorry.
Maybe you can. What do you want to point at? I think Shannon, who's driving this, could point at something.
Yeah, you can see that line we put there. Yeah, that line. That line denotes the center of rotation of the horse's coffin joint. That bottom joint in the horse's foot, and we try to shoe horses so the shoe is placed equally around the coffin joint, around the center of rotation. So you have 50% of the shoe in front of that line and 50% behind. And as horses grow more toe, those proportions on the bottom of the foot change. They migrate forward. Like if you go to the next picture, you can see a racehorse that's due to be shod. So if we were to put, that line on that foot, you can see how much of that shoe is further forward
Right.
of that coffin joint. And that puts a lot of stress on so many structures of the horse. I mean, everything from the flexor tendons to, horses get back sore and neck sore when they're out of alignment. So it affects the horse's whole body. So this is why we keep horses, particularly athletes, on nice short shoeing intervals and trimming intervals.
Okay.
And it was just another example, again, of a horse that's probably overdue to be shod, but you can just see that toe lever and that toe length, and you can just see the biomechanical effects that would have on the lower limb.
So is it, you think, 5 to 6 weeks on that last image from the time that horse was last
Probably,
shod?
yeah, I'd say 5 to 6. Yep.
Okay.
Race horses grow foot quicker than other horses as well. They're athletes. Their circulatory system, their metabolism, everything is just amped up. So they're going to grow foot a little quicker than a horse that's just sitting outside in a pasture somewhere as well. So you got to take that into account when we come up with their with their shoeing cycles.
Sure. Okay. So we're going to show the first video of a horse being reshod. So I think we're going to go ahead and load that up. And then after we watch those, what's happening, we'll just pause for a moment and then just talk about it. So let's go ahead and start with the first image. Yeah.
Let me just clean this here real fast. Oh, okay. So now I'm gonna trim. Him.
So Dr. Morrison, while we're watching this, so the shoes come off. Seems like a lot of foot was trimmed off on this horse. Is that fairly standard, fairly common to take that much foot off?
That's probably, that horse had a little more growth than average, I would say.
Okay.
Yeah, I'd say a little more growth than average.
Okay.
Most horses will grow up to 1/4 of an inch a month, sometimes a little bit less.
Yeah. Okay.
That depends on the season as well. In the winter they'll grow a little less, summer maybe a little more.
Okay. So the tool that the farrier is using to dig out the bottom of the hoof, does the horse feel any of that while he's digging that out? And is there any risk of going too deep into the bottom of the hoof?
Yeah, they shouldn't feel it but there's always that risk. You can be too aggressive. You can take off too much foot that horse looked like he had a very hard foot. You can see his tools like they were having a hard time trimming that sole. So the horse had a good hard foot, which is what you want on a racehorse.
Okay.
You want to be nice and strong and hard. He didn't remove a whole lot of sole on that foot, which I like. I like to leave as much sole in their foot for protection as possible. But you can definitely trim them too short. I mean, that sole is not very thick. It may be, some racehorses may have a 7 millimeter sole. Some may have 12 or 15. And that's probably the hardest thing for farriers to assess, is how much foot to take off of a horse.
So do you think farriers remember a horse that they shod last month? I mean, they'd probably do a lot of horses.
Yeah.
Is it something that they would remember?
I think some of them you remember, and some you have to rely on your, the sole it's a keratinized tissue like skin. So you can appreciate like dead sole and live sole. Like dead skin wants to exfoliate, dead skin want to exfoliate, and so will dead sole. So you can, an experienced farrier can look at a sole and assess it and see what's about to exfoliate and what could be safely trimmed off, and then what's live sole. That live sole is more waxy and has a higher moisture content, and generally we try not to trim into that live sole, that waxy sole. We need to leave all that in there for protection.
Okay, so let's go ahead and look at the next video segment.
Ready?
So it's just smoothing out the edges of the hoof as he continues to trim.
Yeah, and he's just making the wall nice and straight, taking away any flares or dishes. Sometimes the wall will want to bend. So kind of taking down those flares and dishes. What makes a strong structure is a nice straight line. So those flares and dishes are weak spots. We try to tighten up the foot a little bit if they're try to remove some of those hoof capsule distortions, some of those flares and dishes. That's all. So he's just dressing. We call that dressing the foot.
Okay.
And, we'll do that with moderation. You can do that too aggressively as well. So everything's done in moderation on these guys.
So that notch that he just took out of the front of the hoof, well, what's that all about?
Yeah, this horse, he's going to fit this horse with a toe clip. So,
okay.
A clip is a piece of metal flange that kind of bends up, and it helps hold the shoe in place on the hoof. So, normally you rely on the nails to hold the shoe in place.
Right.
It's a lot of stress on the nails, especially on the synthetic surfaces. A lot of these horses are running on more synthetic surfaces, and they don't slide as much, and they have more grip. And a lot of shoes will have a tendency to want to slide back. So we put a toe clip on them to help stabilize that shoe from sliding back, and it takes some stress off the nails. I think it's a good thing.
And we'll probably see that when he puts the shoe on this horse. Yeah. Okay. All right, let's go ahead and tee up the next video.
Yep. I'm just gonna check which size for him. So 6 will be perfect on him. Yep.
How many shoe sizes are there?
There's 8, 9. Yeah, 9. 8, 9. Yeah, there's a size 9. Okay.
He's looking for the right shoe size. Now it's most average race horses are a size 5, 6, or 7 size shoe.
Okay.
So the diameter of an average size racehorse foot, the widest part of the foot, usually about 4 3/4 or so inches. 4 3/4 inches is about an average, but they go up to 5.5 inches. The big feet.
So a horse that's a 2-year-old versus a 3 or 4-year-old, does the hoof keep getting larger as it gets older?
It does actually. It's interesting. It grows up until, I've seen racehorses come back to be stallions, and their feet just keep increasing in size.
Wow. Okay.
The coffin bone continues to grow until they're probably 5 or 6 years of age.
Okay.
And,
so that was interesting to watch him shape the shoe. So he's trying to bend it, shape it to be the best fit. Is that what we're seeing?
Yeah. So we trim the foot to where we want the foot to be, and then we shape the shoe up to match the foot. You don't want to do it. You don't want to do vice versa. You don't want to take a shoe and make the foot match the shoe. So everything's custom made to that horse's foot, and he's checking the proper fit and proper length of shoe. You want the shoe to come back far enough to the heels to give the horse proper heel support. So he's checking.
Yeah. So if this was a brood mare or a horse that didn't need shoes, that foot would likely be just about done.
Yeah.
Okay. So you got the foot shaped the way you want. Now you shape the shoe to fit the foot.
Yeah. And you got to be spot on, because these horses are, they're young horses. They're running. Sometimes they'll step on themselves. They'll pull a shoe real easy. They'll interfere a hind foot to a front foot. So you want to give them enough support. You don't want to give them too much length of shoe, or they'll pull it off. So it's a balancing act, and knowing each horse, what each horse can take, and their conformation. All these things play into how you fit the shoe to each horse. Every horse has a little different conformation, so you'll fit a shoe a little differently for every single horse.
Okay, let's look at the next video and see what's coming up next.
I normally shape him on the store jack. I'll shape one in the store jack in case.
Okay.
But the store jack leaves me a lot of like marks.
Yeah.
I'm just trying to make it look nice.
So one part we're not seeing here, because we couldn't show every video, is he actually trimmed off the tips of both of those, or the shoe. It looks like it's a little bit on the sharp edge.
Oh yeah. Yep.
So
they have the grinder there.
So he's grinding that, kind of smoothing that out, so you don't have a hard edge. Okay.
Yeah, any sharp edges on the shoe will be something a horse can cut himself with. Just lying down in the stall, the shoe can rub up against their elbow or something, or running on the track, he can hit himself. So he's safe. We call it safing the shoe, just safing off all the sharp edges. And he's also removing, right now he's showing sole pressure. He's going to remove a little bit of that inner web of the shoe. He's going to concave that out so there's no pressure on the horse's sole, because you want most of the weight of the shoe to be on the hoof wall, not on the sole. So he's relieving the sole pressure there. Most shoes come from the factory with some of that concavity on the solar surface, but most farriers will go on and take more of that out. There's less than you want on a horse is a bruised. You'll hear bruised feet on race horses all the time. We want to do everything we can to prevent any bruising from the shoe on the horse's hoof. So that's what he's doing there.
So that looks like that farrier's got his own traveling tool shop with him.
Yeah, he's pretty well. It looks like he's pretty well equipped there. Yeah.
So would he use that on all four feet to shape them and size them just right? Okay.
It'd be the same technique on every foot. Yep. Okay. Maybe the hind shoes might be fit a little more length, a little more fuller in the heels, because you don't have to worry about the hind feet pulling the shoe off so much. So a lot of times we'll give them a little more length of shoe behind.
So everything we've seen so far has been on that left front foot that he's working on. Okay.
Yeah,
so let's go ahead.
4 times.
Let's go with the next video.
Gonna check right here.
It looks like he's got it shaped exactly the way.
Yeah, he's getting it shaped just how he wants it. So we'll typically shoe him. Pretty much the shoe will come back to the widest part of the frog. And now he's going to nail it up. And
so I'm looking at all the holes in the shoe. How many nails go into this?
Typically, we'll try to do the least amount of nails as possible. It's going to hold the shoe in place. So that'll vary from horse to horse as well. If a horse has a very good, strong hoof wall, we may just put 5 or 6 nails in. If a horse has very weak walls, you may put a few extra nails in to help secure it in place. But 8 would be usually the maximum amount we would put in. But I'd say 6.
4 on each side. Okay.
Yeah, 4 on each side. But more typically, we would do 3 on each side. That would be average, 3 on each side.
It always makes me cringe whenever I would see a nail going into what are some of the risks here, if any?
Yeah, well, so race horses are very thin-walled, unlike other breeds. The race horses are a hot breed, so they're thin-skinned, they're thin hoof walled and thin soled. That's all part of their integument. So nailing them could be a little more difficult than nailing other breeds because their wall is so thin. So you're trying to just get that nail in to the white line, which is that junction between the sole and the hoof wall. You don't want to get it into the sole, or that's where the sensitive tissue is. So you can make them sore. So nailing up racehorses is a little more meticulous process than other breeds because you're dealing with.
So you really do want that hoof to grow enough so that where those holes were from the past shoeing get trimmed off.
Yeah, and that's a problem with some horses. Some horses don't grow wall well. Like some people don't grow nails or hair well, and sometimes you end up with Swiss cheese, just a bunch of holes in the wall from horses having to nail them too many times without them replenishing and replacing that wall.
We'll talk a moment about gluing a shoe. I thought I heard on the broadcast of the Breeders' Cup that White Abarrio won that Breeders' Cup Classic with glued-on shoes. I think I heard it correct. Is that your understanding?
Yeah, I think that's right. Yeah, there are many good horses that have won high-level races with glue-on shoes. Glue-on shoes have become a fairly common thing in the racehorse farrier industry.
What percent-wise? 10% of the horses, larger percentage?
Yeah, I'd say 10% would be 10% would be, yeah.
Okay.
I'd say most horses have had a glue-on shoe at one time or another in their life. I'd say usually we use glue-on shoes for maybe 1 or 2 shoeing cycles till some of those nail holes grow out, and then we'll go back to nail-on shoes. So we'll use it as an aid that way.
And that glue lasts long enough that the horse doesn't shed the shoe?
Yeah, it's a methyl methacrylate glue. It's very strong. It's used in other purposes and in other industries as well. It's extremely strong. It's so strong though that sometimes the hoof needs to expand and contract. Sometimes when you glue an aluminum shoe on a foot, you'll stop that expansion and contraction. So some horses don't do well with them long term. Some do well with them short term. And there are different types of glue-on shoes that allow expansion and contraction. There's so many different shoes on the market nowadays. We're very lucky. But glue is very useful for securing a shoe to a horse's foot, and it's a lot stronger than a nail-on shoe when done properly.
Okay, good to know. All right, so let's bring up the next video.
Okay.
It looks like he's just clipping off the nail heads at this point.
Yeah, so he nailed the shoe up, 3 nails on each side, and then he bends the nails over, and now he's cutting the nails. And then he's going to eventually he's going to bring that foot forward, and he's going to clinch the nails. So he's just rasping a little groove under the shoe, under the nail, a little groove for bend the tip of those nails down. Call it a clinch. He's going to make a little bend, and he's going to push that into the hoof wall, and that's going to secure the shoe in place.
Okay.
So it's that nail bent over, forming a clinch. Now he's bending it over now with this. These are clinchers.
All right.
And it's a very strong, it's amazing. Been nailing shoes on for hundreds and hundreds of years. It's still a very reliable way to keep a shoe on a horse's foot.
Yeah. So that's one foot that was done. So you got 3 more to do that. That looked like that took probably 10, 15 minutes. Is it about an hour plus?
Yeah. Yeah. It could take anywhere, usually 40. Some people go faster than others, but 30 minutes to an hour is usually what it takes to shoe a horse.
Okay.
An hour.
Okay.
If you're doing all the precautions.
Well, and I would bet having a good handler that holds the horse helps too.
Yeah, that is so important. Have a good environment, a good place to shoe the horse where there's not a lot of traffic. If you have a nice flat spot with mats where you can really evaluate toe length and balance, all those things are very helpful. Having a good quiet area to shoe the horse.
Okay.
It's very good. And a good handler is number one. Because sometimes there's colts, and they'll be mouthy. They may want to nip you and bite you. So you want to make sure the guy, whoever, or the woman, whoever's holding the horse is watching out for you.
Yeah, I always enjoyed when I had mares and foals holding that foal for the first time.
Yeah. Yeah, foals are tricky.
They are. So we got one more image to throw up on the screen. I think we got a before and after shot of this horse's foot. Can we bring that up next? Okay, so there on the left is what we started with, and looks like on the right is what we finished with.
Yep. Yeah, so we got some more proper proportions back in place. the shoe is set back, so it's much better biomechanical setup on the after shoeing.
Okay, perfect. Okay. So we got a few questions from the audience. So let's go ahead and jump over to some questions. Please comment in the role of the farrier in managing weanlings with upright pasterns on hind legs. So a weanling that has upright pasterns on hind legs, what's the farrier's role in helping to manage that?
Okay, if it's a number one, if it's an acquired thing, like he was born normal and became upright, we try to have the veterinarian evaluate them, because there are some lameness issues in the hind end. Stifle pain can make horses become upright. So, got to say, number one, getting a veterinarian involved, making sure there's no other secondary causes of pain that would make them become upright would be number one. So as far as the farrier goes, for upright pasterns, we try to leave as much toe length on them as possible to help stretch their flexor tendons and stabilize them. If they get very upright, they'll want to just knuckle over. So you don't want to trim their feet too short. In that case, you may make them want to knuckle over and be unstable. So trimming, number one. Number two, if they weren't responding to trimming, sometimes if we have an extreme case or a case that's not responding to trimming, we'll do little wedge shoes behind until they go through. Sometimes it's just a growth spurt they go through, and they'll grow out of it. So,
okay.
I think we want to know if the horse is getting better with time or worse with time. If they're getting worse with time and it's getting worse and worse, sometimes we'll go to a little heel elevation shoe to help take stress off the flexor tendons to drop the pastern angle. Okay, so
there are things that the farrier can do to help with that situation.
Yeah. Trimming first, sometimes monitoring and trimming, not improving with trimming, a shoe, a little elevated heel shoe.
Okay, so here's a question. Is there a risk of infection in the old exposed holes from the shoe that was removed?
Okay, from the nail holes, usually not.
Okay.
Usually not. You do worry about some horses will get a fungal infection called white line disease. Will deteriorate the hoof wall, but usually that's not in nail holes. Usually it's an old abscess tract or something like that, something deeper, not just a nail hole.
Okay. So here's a good question. I've often wondered this myself. How do horses in the wild get along without ever having their feet trimmed?
Oh, yeah. Well, there's these little elves that come out at night. We don't see them. Now that, wild horses have been tracked to, they travel quite long distances, 20, 30 miles a day, on rough terrain, so that they will wear down their feet naturally. But it's interesting. It depends on what kind of environment the horses are in. If you look at like the Shinkatink ponies, on the East Coast that live in that marshy area, those are wild horses. They're not going to really wear their hooves down. They tend to grow their hooves long and then just break them off, which is not ideal because, you could break off into sensitive tissue very easily. But most of them will wear their feet down just because they do more walking, more roaming, more foraging than your domesticated horse. So they'll wear it. Yeah.
Well, that leads into the next question. You hear the saying, no hoof, no horse. And horses deal with all sorts of foot issues, abscesses, and quarter cracks, thrush. So can you talk a little bit about some of these common issues that affects an owner's racehorses? And I would assume horses in the wild deal with some of those same things.
Yeah. Thrush is thrush is an infection in the frog of the horse's foot. So it's usually feet that aren't cleaned out enough. They'll get it's a mixed population of bacteria and different types of fungus that'll deteriorate the epithelial layer of the frog, and it'll go into sensitive tissue. So a lot of that those horses just need chronic daily hoof maintenance. Normal picking out the foot every day usually resolves that. Quarter cracks are very common in race horses. Horses at speed put a lot of stress on their heels. They kind of beat up their heels. We said most horses, their hoof angle will decrease by 3 degrees every shoeing cycle. But most race horses, their hoof angle will decrease over years of just being a racehorse from pounding on their heels. You see older race horses have a lower hoof angle than younger race horses. So a lot of stress and concussion on the heels, and they can lead to quarter cracks. Typically, it's on the inside heel. If you watch a racehorse gallop, they'll typically land on their outside of their foot, and they'll slam the inside down, and they'll get so it can crack the hoof wall into sensitive tissue.
What's the healing time for a quarter crack?
Yeah, so we have things that can speed up the healing process now. We have glue. We talked about glues earlier. So one common thing we'll do is we'll patch a quarter crack with a methyl methacrylate and a real strong fabric, usually a Kevlar or fiberglass pad. So we can get the horse comfortable pretty quickly after a quarter crack, like the next day or two. The problem is if they get infected, that's, if you get an infection in the quarter crack, that delays things. So when you hear of horses with these quarter cracks that are having ongoing issues, sometimes there's an infection in the quarter crack. So
okay. So I see Dr. Tanner's jumped on, so I think we're going to wrap up here, Dr. Morrison. Really appreciate your insights, your time. Help us better understand the whole process of proper shoeing, and I know we just kind of scratched the surface, but I really do appreciate your time and your insights.
Yeah, thanks for having me.
Okay, thank you much, Dr. Tanner.
Hello,
how are you? Yeah, glad to have you with us. So for our audience, I'd like to introduce Dr. Tanner. Dr. Tanner obtained a bachelor's degree in animal science from the University of Kentucky. Go Cats, yeah. Followed by his veterinary school at Auburn University, graduated in 2005. After graduation, Dr. Tanner completed an internship at Rood and Riddle, and the following year became an associate and served as a resident veterinarian for Shadwell Farm. Dr. Tanner became a shareholder in Rood and Riddle back in 2012, and he's one of the very few board-certified veterinary dentists. His ambulatory practice is largely focused on dentistry, reproduction, neonatal, foal care, and herd health. So welcome. Thanks for joining us, Dr. Tanner.
Well, thank you for having me. I appreciate it.
Okay, great. So we've got a short video of a horse having its teeth floated or filed. But before we watch the video, I just have a couple questions just to kind of set things up. So, so how does the care of equine teeth compare with human dentistry? I mean, do horses get cavities? Do you give them fillings, or what's the comparison of equine versus human dentistry?
Yeah, good question, because I think we're all pretty familiar with what we go through as the patients ourselves, right? When we go sit in the chair, relaxed, open our mouth on our own accord at askings. My patients don't always do that. But yeah, the differences are, there's some unique things about a horse's tooth. The horse teeth are constantly growing through the course of their life. Whereas you and I, post-puberty, 18 years of age, or maybe even earlier, our teeth are done growing. Once they've grown into a certain size, that's what we have the rest of our life. Whereas horses continue to erupt or grow the tooth down into the chewing surface. So with that creates some problems or opportunities to help horses out whenever things continue to grow and don't get ground away from constant chewing. Things become sharp. But as far as the comparison with humans, we have similar fields in equine dentistry as what we have in human dentistry. We do endodontics, we do periodontics, orthodontics. Each of the fields, imaging, each of the fields of specialty in human medicine are things that we study and gain research on in horses as well.
Okay, great. So we have baby teeth as little ones, and then we drop those when we get our adult teeth. Do horses have their full teeth and then they lose them into adult teeth?
That's exactly right. Very similar to us. Yeah, you're exactly right. So they've got their baby teeth, and you'll find them sometimes, especially if you've got race horses and young horses. You'll find little baby teeth in the feed tubs. It's a common place to find them. And, if you're not expecting that, it can be startling. It's like, oh, wow, what just happened here? Okay. Very common. The front teeth in particular, those are easy ones to find. So all 12, 6 on the top, 6 on the bottom, will come off between 2.5 and 5 years of age. Those will all go off and go away. And then there's also 12 molars or cheek teeth, they're actually the premolars, will shed away as well in a similar time frame between 2.5 and 5 years of age. So you've got an opportunity to find up to 24 baby teeth. Tooth fairy better have a little Fort Knox at home.
Right. Okay, so now we're going to watch a video of Dr. Tanner doing dentistry on a horse, and then we're going to stop throughout and ask a couple questions. So let's go ahead and start up with that first video, and then we'll pause and I have a couple questions.
You know what? I'm able, from where you're standing, I'm able to get the screen on here also.
Oh, well then aren't you amazing?
Of course.
Okay, so let's just talk about what took place. It looks like you rinsed out the horse's mouth. You've got some kind of a brace on his mouth. What exactly is that?
Yeah, it's that is a oral speculum, a mouth speculum, and that allows me to safely put my fingers in the mouth to look around, safely put equipment in the mouth, a bright light, or in this case, this horse just happened to be at the hospital. I had an endoscope in the mouth. Commonly on the farm setting or stable setting, we'll use mirrors with lights. But that speculum actually keeps the horse's mouth open so that we can see everything in the mouth. Just like our dentists, they want to look at all the surfaces of the tooth. You know, it's if you're going to do an exam, a dental exam, you need to see the teeth and see around the teeth.
Okay.
So that I'm glad you brought that up. That helped me open up the mouth, look inside. I used water to rinse out all the feed that gets around the teeth as well.
So would this horse have been sedated at all?
It would have been, yes. Yeah, good point. This horse would have been sedated, usually just enough that you can get their mouth to open up, have a good look around. You know, to use something like that without sedation, it would be a little dangerous. You know, it can be in some horses to put a piece of metal in their mouth and have them move their head side to side. It just is a safety precaution for the humans around and the horses.
So on that video, it looked like you're looking at the top roof of the mouth. It looked like those teeth were pretty uneven. So is the goal to level those out?
So that's part of that unevenness is a natural part of their anatomy. Those teeth on the chewing surface naturally have small undulations, and it's a crushing surface meant to crush all the fibers of the hay in the diet or the grass in the diet, corn, oats, whatever it is they're eating. The particle size, once they swallow it, the particle size does not get any smaller until it comes out the back end of the business end. So they need to do all the crushing, all the grinding with those molars and premolars. So you'll see some uneven areas there. Now along the cheeks on the top, there's areas where they get quite overgrown, quite tall. So if you're talking about this, so if you're talking about the unevenness along the cheeks on the outside on those tops, that's an area that gets quite sharp.
Yeah, we'll see that coming up because I know we've got a video of that. Yeah. Okay. So let's go ahead and show the next video, and then we'll talk about that.
Here a little bit, forward here a little bit.
Go right ahead. Mirror. Look at the mirror. You can look over my shoulder if you want. Look at the mouth with your camera.
Big that mirror is.
Right? It dawned on me they're more likely to see somebody use a mirror at a farm, you know, this big endoscope, myself included. All right, let's look at the scope.
Go.
So this is a rotating flat disc burr. There are other methods of floating the teeth, including a straight rasp that's used by hand. This is a motorized rasp. It spins circular, and this particular one has water that keeps everything cool. So this is safe to use in the mouth, and I know that because I can put it on my hand and cause no trauma at all.
Okay, so for those of us that just love going to the dentist and hearing those tools, that just brings back memory. So that circular motion works like sandpaper. So does the horse feel any of that when you're doing the floating? Is there any discomfort to the horse while you're doing that?
So no, there's not. I'm glad you asked that. It is a spinning, rotating disc on healthy, normal teeth. There's no reaction, no movement at all of the horse in reaction. You know, in fact, we can use that as a diagnostic tool. If the horse does react as you're floating over the top of it, something's wrong, because there should be no sensation, no pain. The parts and the surfaces of the teeth that we float away don't have nerve endings. They don't have should have no pain associated with them at all. And as long as the float is in contact with the tooth, the horse should not be reacting. So if you do in the odd horse or the occasional horse where you do get some reaction, that's a light bulb moment of, hey, we need to explore this a little further.
Okay, so they're feeling something, or maybe they don't like the sound of that too much, and they just react to the sound.
Yeah, but normally you can tell they'll react as soon as you turn it on before you put it in their mouth if the sound's going to bother them. But if you touch a tooth that's infected, or if you touch a tooth that's broken, there's a different type of vibration, and the horse will feel that vibration go down the nerve.
Very good. Okay. So you mentioned the handheld rasp, and I've seen horses have their teeth floated many times with the handheld rasp. Can you compare the two as far as getting the job done?
Sure. You can get the job done with either one of those. They are tried and true. The hand rasp has been around for literally hundreds of years. You can find it in textbooks that date back to the 1600s in Europe. So the hand rasp is something that has been around. I'm sure it's very good in Dr. Morrison's hands working on the feet. It's not so good in my hands working in the mouth because it's a large, crude instrument that I can't necessarily control exactly where it is in the horse's mouth. It's fairly long. It comes into contact with several teeth at a time in the power stroke as it's moving. I prefer an instrument that I can manually place in individual areas of the mouth, one tooth at a time. And with that, I can use it more as a surgical instrument as I'm floating away teeth.
So the motion of the rasp, I mean, you're literally rasping up and down the surface of the teeth.
Correct.
Okay.
Correct. And those typically are carbide tipped. So they're very, much more aggressive. You would never put that on your hand and pull it across in demonstration to show somebody how the rasp works, because your hand would look like hamburger afterwards.
Okay.
So you would not have seen me do that in this demonstration.
Okay. All right. So next video. Okay, so now we've just seen a portion of this horse's mouth being floated. Typically, how long does that take to do a full mouth?
Maybe about 5 minutes. The actual floating does not. I spend as much or more time looking at the mouth, looking at each of the teeth, the tissues around the teeth, the tongue, the hard palate, soft palate, where the bit sits. If this is a horse in performance, I spend as much time looking at all the surfaces as I actually do floating. So the floating is about 5 minutes total.
Okay, so I'm just trying to associate when I'm at the dentist and they're filing my teeth, and of course, I'm laying on the back, and you got water going in, and you're practically gagging and trying to catch a breath of air. How does that work for the horse? Because I know you had water at the end of that circular disc spraying into the horse's mouth, keep it cool. How does the horse react to that, and where does all that water go?
Yeah, so great questions, because you and I are laying back. All that water pulls to the back of our throat, so we have that gag reflex, and we're constantly feel like we're gagging. So luckily, the horse's nose is tipped forward, so any water that's going in his mouth is sliding out just like the saliva towards the tip of his tongue.
Okay, so he doesn't have that gag reflex. So how often should a horse have their teeth floated? And if a horse doesn't have their teeth floated regularly, are there any health issues associated with that?
Yeah, I tell you what, those are two top questions, really. I'd like to say that the health of the horse is always, that's why we do what we do. And, if you can't eat, it's hard to be healthy. If you can't process your diet normally, you can't be healthy. If you can't break down the forage that you're eating into smaller particles as you pass it down your throat, you're predisposed to choking, you're predisposed to colic, you're predisposed to medical problems, concerns. You're going to be underweight if you can't chew properly, chew without pain. So the teeth are where the GI tract starts. That's the lips are the beginning of the digestive tract, and so the teeth are quite important for that. And as far as frequency of floating, part of that depends on the age of the horse and what the horse is used for. Young horses' teeth grow really fast, which isn't surprising. The horses themselves are growing fast as well. Baby teeth are coming off, caps are coming off. We call the baby teeth caps in the horses, and those are being shed. So horses that are between 2 and 5, 2 and 6 years old, their teeth are growing much faster than your horse that's 15 to 20. And so as a result, we'll recommend that their teeth are floated every 6 months to try to keep up with those changes. And as they get older, then it comes down to how much work are they in? Is this our happy broodmare out in the pasture that doesn't have a bit in her mouth? If that's the case, once a year is typically enough for an adult horse to have their teeth floated at pasture. If this is your thoroughbred on the track that's running, that's in training, even on to the twilight of his career, which is I love seeing as a racing fan. It's fantastic. He probably still needs to be done every 6 months, so the bit fits comfortable in his mouth and he can react to the cues that the rider's given him.
Okay, so there are dentists and vets around the backside of the racetrack. I mean, you think of all the hundreds and hundreds of horses on the backside doing this dentistry work on a regular basis.
Oh yeah, absolutely. And the trainers know that it's absolutely important for the horses. Some of the things you'll see horses eating their grain, but it's falling out of their mouth as fast as it's going in. And a lot of times that's an indication of, hey, my teeth are very sharp. They hurt my cheeks. And when I chew side to side, it hurts. If you ever bite your lip, it doesn't feel good. And so,
well, didn't Secretariat, when he lost the Wood Memorial, they found afterwards he had an abscess?
That is correct. He had that reported. Luckily I was not there. I wasn't responsible for that. But that was reported that he had an abscess in the corner of his mouth, and that was a big source of pain for him. And I think sometimes we think of these big, strong, beautiful creatures and athletes as just amazing gladiators, but they are living, breathing creatures, and pain is real. Pain hurts. And so oral pain for an animal that's a herbivore that grazes, I know our racehorses are not grazing all the time, but preferentially this is an animal that would chew for 14 hours a day, which is a lot of.
With exercise riders and jockeys, of course they've got the reins and they can feel the bit. Would they be able to detect if there's a tooth problem in a horse?
A lot of times they will. And a lot of times that's the first person that will notice things, either the groom that's feeding them, watching things coming out of their mouth, or the person that's on their back. The person that has the reins in their hand oftentimes will tell a trainer or tell someone, hey, we're tossing our head this way, we're fighting the contact another direction. I don't have steering. You'll get all kinds of feedback from the riders.
Okay. So we got one more video to watch. So we watched Dr. Tanner from the outside doing the work. Now we've got a camera inside the horse's mouth. So let's go ahead and watch that video. Yeah, I don't think there's any sound with this one, but that's okay, hearing that grinding sound.
Yeah, you might be cringing right now. So yeah, I can walk you through it though. So that flow.
Well, it looks like there's sharp edges. Is that the cheek that you're doing there?
That's the cheek. Yeah. So on the left hand of the image, that's the cheek. And then those teeth, or that real white area that I was floating away, that's just disappeared on the outside of those teeth. It was very sharp. I mean, this would cut your fingers and cut the cheeks. So we go in there, and it takes about 30 seconds to take care of that on one side. And so I've done the horse's upper right to the left of your image, and now the float has moved down, and it's on the bottom row of teeth. And on the bottom row of teeth, you actually float close to the tongue. So another really sensitive structure, and those really sharp teeth will cut the tongue. You'll find that pretty often. So there in about a minute, I just took care of the right-hand side of this horse's mouth, and now we've moved over to the opposite side.
Okay. And I would assume with those jagged edges, chewing is uncomfortable.
Absolutely. Yep. Every bite is uncomfortable.
Maybe that's why I've noticed where a veterinarian or a dentist will actually take their finger and just go in the horse's mouth and kind of rub along the side to feel for those edges.
That's right, Gary. You can feel especially the top row of teeth, because that top jaw is wider than the bottom. A lot of times we'll run our fingers in there and just feel the outer edges. The bottom teeth are a little more challenging, because without a mouth speculum on, it's a good way to get bitten.
Okay. Yeah. So it looks like you're just smoothing all that out right there. Good.
Yep.
Okay. So while this is going on, at what age should all this dentistry begin for a horse?
We usually start about 1 year of age. Our yearling thoroughbred population will routinely float their teeth prior to going into training in the fall of their yearling year, or sometimes in the summer if they're in sales prep. Will float their teeth in sales prep, because anytime they're being introduced to a bit. And so sales prep, a lot of horses will have a shiftney in their mouth. And so we'll commonly float their teeth so the shiftney doesn't pull the lips, cheeks into some contact of sharp edges.
Now, the darkness we're seeing in the teeth, what is that? That's not cavities. What is that?
Yeah, that's not cavities. That's actually dentin. So just like our teeth are made up of enamel and dentin and cementum, horses are also made up of enamel, dentin, and cementum. The dentin is really soft compared to the enamel. And so the dentin will stain easily. And so this horse is not a coffee drinker, although that's what you would think you expect to see in the stain. But it's actually tannic acid from the forage. Hay has tannic acid in it naturally.
Okay. And you had mentioned already that broodmares, stallions, you still have their teeth floated on at least an annual basis.
That's correct. Yeah, we recommend that annually. I do several stallions here in town, and others do them as well. But we will do them once annually.
Okay. So that's the end of the video. Let's go ahead and jump into some questions from the audience. So here's the first question. Let's do that. Before we do that, we got a video from our Q&A sponsor, West Point Thoroughbreds, and let me sort through some of these questions. So we'll be right back in just a moment.
How do you become the gold standard in racing partnerships? One horse, one partner, one victory at a time. Congratulations to all our partners who have made West Point the gold standard for the last 3 decades.
Okay, thank you, West Point. So here's a question. What are the changes to teeth that allow aging of a horse? So I guess, how do the teeth change as they age?
Yeah, the easiest thing for people to see are the front teeth, the incisors. When horses are young, the teeth are very vertical. The front teeth will just be very vertical in their orientation to one another. And as a horse gets older, we've all heard the expression long in the tooth. Those teeth literally become longer, and they become more angled forward towards you in a way that you're seeing more of the tooth. So that's the expression long in the tooth. Now there's always outliers. We've all been around cribbers, and the cribbers will wear their teeth down from chewing and biting on fence post or in the stall. But as a rule of thumb, the long tooth is an older horse. The shorter tooth is older tooth is a long horse. The old horse, the short tooth is a young horse. The other area is the chewing surface of the teeth. You can look at the chewing surface of those front teeth with the horse mouth open, and there are some telltale signs along that chewing surface that we'll use to age them. There's several things published in aging guides that folks will use. These are really just guidelines. There's nothing that's a foolproof plan. The Jockey Club is always going to be more accurate than I am when trying to age a horse. Registration papers are the best way to go.
Okay, so I think you answered this next question. Some horses are cribbers. Does cribbing have any effect on the horse's front teeth? Sounds like it does somewhat.
It does. They can flat wear them down. I mean, they can wear those front teeth down to just nubblings in the front. Some horses are very traumatic and very rough on their teeth as a part of this vice or this habit that they develop oftentimes young in life.
And I think you also hit on this, but I'm going to ask it again from our audience. What would be the first sign that a horse should have its teeth floated?
Yeah, a lot of times the complaint I'll get is one of two. Let's say it's a performance horse, then it's a lot of times performance related. The jockey, the rider, let's say it's a thoroughbred after his racing career, and now he's an eventer or he has another job as a hunter. I'm getting that call from a rider or a trainer where the horse is just being a little Andrean contact. The cue of the reins pulling on the bit, the horse is not steering, he's not stopping, he's not turning, he's not collecting. Lots of things get reported, but there's a fight going on between the rider and the horse. So that's one time I get called. The other time is horses dropping grain. They're eating, and maybe they're holding their head sideways when they eat. Just like you or I, if we have a painful area in our mouth, we will move that pain. We won't stop eating. Right? I mean, if we get a bad tooth, we won't stop eating. We'll eat on the other side.
Right.
To eat on the side, you got to work to move the food across your mouth. And so if you watch a horse that's having some discomfort, just like you or I, they'll use their tongue, and we're not going to crunch down on a peanut on a tooth that hurts, but we'll move it on the other side of our mouth and chew on a place that's okay. So the horses do the same thing. So you'll see some deliberate motions with their tongue, with their head. That is usually a key moment that a caregiver will see that and make a call.
So even a pleasure horse, somebody's got a nice pasture horse that they like to ride, should have their teeth done. I mean, if they start dropping weight, is that a sign that they're not eating properly?
Absolutely. Anytime you get a skinny horse and the body condition is not where you want it to be. Honestly, this is the time of the year right now. We're going into the fall, winter season. This is a time you'd like your horses to have as much body condition as possible going into the winter. So if you got anything skinny right now, that's not ideal. So this is a prime time to be looking.
Okay. Well, here's an interesting question. We've heard the term parrot mouth. Can you explain what that is?
Sure. Yeah. Parrot mouth is, think about the beak of a parrot or the beak of some of these toucans and exotic birds. That top beak curves out and goes over the bottom beak. And so there's a hooking action of the top jaw. In those. We see the same thing in horses. If horses' front teeth don't line up and there's an overbite and an overjet, it hooks. And so you'll see this big goofy upper lip on a horse with a parrot mouth. And what it is, it's the front teeth don't line up. The top jaw is just longer than the bottom jaw. So
are there varying degrees of that?
There are. Some are very subtle and you wouldn't notice them without raising the lips up. And it's purely cosmetic. Others are very dramatic, and that lip just hangs forward and doesn't even contact the lower lip. So very, very dramatic changes sometimes.
Does that affect a horse's ability to graze?
It does not. I always say that hunger is a great motivator. I'm probably proof of that. But they'll adapt. Horses are just amazing creatures. They'll adapt. They use their lips in those cases, and they do find a way.
Okay, so last question here. And a similar question we asked Dr. Morrison. So since horses in the wild don't have dental procedures performed on them, how do they survive in the wild when their teeth continue to grow?
Yeah, great question. We've spent a lot of time studying this exact thing, trying to determine, should we intervene, should we not intervene? And what we've found looking through the fossil record of horses over, millennia is horses are growing to be a lot older now than they once were. Think about horses just in our lifetime. I can remember being younger when 20 years old was a really old horse. And now I routinely see 30-year-old patients nearly every day at some point. And so horses are living to be a lot older. And so, those horses that were out in the wild, they did fine until a predator got them, right? They weren't living on lush green pastures. So, and that's another thing. The forage has changed. My horses are grazing, cut off pasture at 8 inches height. That's all cool season grasses. It's really nice, lush pasture. They're not eating in the Sudan. They're not eating high sand, gritty silica. Think about Johnson grass, thinking about really abrasive grasses. Those grasses would wear away teeth really, really fast. We're biting and chewing the soft, lush alfalfa, the soft, lush fescue, orchard grass. It's not wearing away the tooth the way it would in a wild environment where the horses were meant to graze. And so the teeth don't get worn away by the forage in the ways they would have in the wild.
Okay, that's good to know. So their natural environment kind of takes care of them. Okay, so that wraps up our questions. So I'd like to thank both Dr. Tanner. I know Dr. Morrison's moved on. Dr. Tanner, really appreciate all the insights, all your time. And I think it's safe to say that your explanations in these videos goes a long way in just helping us all understand equine dentistry and the hoof care for racehorses. So really do appreciate your time and your insights.
Thank you for having me. I sure appreciate it.
Okay, so before we close out, I'd like to point out that our friends at Toba, they're going to be hosting a seminar on claiming on December the 2nd at the Fairgrounds racetrack. And that's the same day as the Claiming Crown races. So if you'd like to register for the Toba Claiming Seminar and go to those races on the Claiming Crown, just visit toba.org, and there's a flyer that they sent to us. So on December 2nd at Fairgrounds Racetrack. Finally, I'd like to again thank our sponsors, especially our panel sponsor today, Equiloom. But most of all, I really want to thank the owners, because without the owners, we simply don't, who invest in our horses, we simply don't have a product or an industry that we all love. So thank you for being with us today. We'll be back in December with our final 2023 online webinar, and then we'll be back next year. But until then, we hope you visit the Winter Circle, and we hope you visit it often. Thank you, everyone, and we're going to sign off now. Thanks.